Good morning, Dr. George Yakos here from WPR Medical, and I'm often faced with patients in the office who come in for coronary artery problems. And again, because of the age that they're usually presenting at, they're also having significant arthritic and orthopedic pains. So at the same time as when they are taking their cardiac medications, they're also on anti-inflammatory medications. Although these medications can provide relief from pain on a temporary basis, as a class, they increase the risk for cardiovascular disease such as strokes and heart attacks with chronic use. Inevitably, my conversation with these patients leads to a recommendation for CBD oil given its much more favorable profile, as it does not increase the risk for strokes and heart attacks and works very well for mild to moderate pain. CBD oil often is a fantastic anti-inflammatory medication and does not pose the same risks as Celebrex, Aleve, Naprosyn, ibuprofen, and Motrin do. What's really funny is that usually this is the point where the patient turns around to their partner and says, hey, I'm going to be getting marijuana from my doctor, and that's not true. This is why I wanted to post today, so that I could explain what is the endocannabinoid system and what is CBD oil. The endocannabinoid system, or ECS, is a body-wide signaling network that promotes homeostasis. In other words, as your external environment changes, the ECS keeps your body's internal processes stable. When life stresses increase, for example, the ECS helps maintain neuroplasticity to reduce the risk of depression and anxiety. In a similar way, the ECS helps balance processes that resolve inflammation and regulate immune response. So how does it work? The ECS is a network of receptors and signaling molecules. The two types of receptors are called CB1 and CB2. As threats to your biological balance arise, signaling molecules called endocannabinoids, or ECBs, bind to CB1 and CB2 receptors, triggering a cascade of signals that help maintain homeostasis. Our bodies naturally produce ECBs, but poor diet and lack of exercise and other factors can disrupt ECB production. This contributes to a biological imbalance and conditions such as chronic inflammation, poor immune response, depression, and anxiety. CB2 receptors are present on cells throughout the immune system and are involved in resolving inflammation. Your immune system often triggers inflammation throughout the body. In response to this inflammation, the endocannabinoid system, or ECS, releases endocannabinoids, or ECBs, called anandamide or 2-AG. When anandamide or 2-AG bind to immune system CB2 receptors, they help initiate the resolution phase of inflammation. An effective endocannabinoid system is therefore like a dance partner working with your immune system to create a balanced interplay of healthy inflammation and resolution. Poor diet, lack of exercise, and other factors can disrupt your body's natural ability to produce anandamide and 2-AG. This effectively ruins this important dance and contributes to unresolved chronic inflammation. The good news is that hemp oil and omega-3 fatty acids will help restore an impaired ECS. Hemp oil, which contains less than 0.3% of THC, is a food-grade oil with natural cannabinoids and phytoactives that bind to CB2 receptors. Omega-3 fatty acids help your body to create more of its own endocannabinoids, anandamide and 2-AG. Taken together, hemp oil and omega-3s help restore your ECS so that it can work with your immune system to effectively resolve inflammation. So for those with mild to moderate pain, poor diet, and a sedentary lifestyle, hemp oil, CBD, or omega-3 fatty acids are excellent supplements to help their sense of well-being. Being able to achieve optimal health and reduce medications is what WPR Medical is designed to do. Click below to make a free 20-minute consultation to see if we can work together to achieve optimal health. Or visit our e-store where we have curated a tremendous amount of top-of-the-line supplements. Also, please join us on our Facebook or Instagram. WPR Medical.